Welcome to Leading Entrepreneurs of the World. I'm Stelios Hatzakis, CEO of One Business World. Leading Entrepreneurs of the World features entrepreneurs, founders, and business leaders presenting on cutting-edge topics and the latest industry developments. Today, we're very pleased to welcome leading global entrepreneur Christophe Billiottet. Christophe is a co-founder and the CEO of ADGS, a disruptive deep technology company. Christophe is an entrepreneur who founded 4 successful startups over the last 30 years. Educated as a fighter pilot in the French Air Force, Christophe has 28 years of experience with internet technologies, security, software engineering, database systems, and business re-engineering, and has developed and managed several successful high-tech companies in the US and in Europe. At ADGS, Christophe and his team specialize in the fields of behavioral biometrics and biological systems applied to cybersecurity, agent-based modeling applied to emerging behavior, and artificial intelligence applied to unstructured data. ADGS conducts fundamental science research and creates algorithms to develop futuristic applications. One of the very disruptive solutions that ADGS has developed is PandExit, an agent-based modeling for predicting pandemics, and as a tool, it helps evaluate outcomes and estimate the evolution of a pandemic through several configurable scenarios. Christophe, we are very happy to have you here with us today to hear more about the ever important notion and process of predicting pandemics, and specifically in today's world, analyzing and predicting COVID-19, and about your and your team's efforts at ADGS. Welcome.
Thank you very much, Stelios. Hello, everyone. Thank you to One Business World to give me the opportunity to talk a few minutes. And I will speak about a methodology to predict the pandemic evolution, particularly usual pandemic, I mean regular pandemics, but also the COVID-19 pandemics. So I will start to share my screen, so you will be able to show you. Okay, so as you can see, if everybody were living locked at home, there would be no pandemic. In fact, there is pandemic, or there are pandemics, because there are social interaction between people. If there were no social interaction, no pandemic. So from this modern age, we are traveling around the world, we are moving to work, we are going to study, we are living in cities, we're social animals. So that's why the pandemic, it's perfect for them to start moving around the world very, very quickly, as we have been able to see for the COVID-19. So the social dynamics is based on the social behavior of people when they are interacting, yes? So if you take, for instance, the connections between people, they can go very, very quickly. I mean, you start with just one dot, and then you get a kind of a web of connections between the different dots. Yeah, and this shows how the fabric of pandemic can be very, very dangerous. So until the second part of the 20th century, they were using deterministic model to use time-dependent differential equations. This is what we name the SIR model, SIR. It's susceptible, infected, and recovered. I will not go very deep into this situation because this is not the subject we are speaking. We will speak about agent-based modeling. And particularly because the SIR model is okay for homogeneous population. But if we start trying to modelize or to model population when there are, let's say, millions of different cases, the equation number explodes, and even the most powerful computer cannot find any solution for that. So what the solution is the agent-based modeling, or ABM. If we could describe and simulate the social fabric of a country as well as the social behavior of its inhabitants, then we could understand what opportunities exist for a virus to spread. So globally, we would have to describe the entire social fabric of the country to be able to know exactly what will happen with the pandemic. So the idea is to try to simulate this, but by using a new different method, which is ABM. So the ABM is working as it considers people as agents. So each person, each inhabitant on the planet becomes an agent. And each agent has a set of behaviors. So it means some way of interacting with other agents. So we can say that each agent, each inhabitant of a country has a small program, is a small program. The small program is autonomous. It can goes and go to work. It can change different things. That, for instance, there are 4 different attributes in the agents. Their attributes are, for instance, sex and conditions, preconditions. I mean, for instance, the sex, women, men, preconditions. It could be, for instance, somebody who is diabetic, who is obese, who has who is old, because we're also taking an age structure of the country. So we have people over 70 years old, people younger than 15 years old. All these are reacting individually in a certain way with the pandemic. So we have to take all these preconditions and these attributes for each one of the agents. Then we have a kind of relationships between the agents. So where do they meet? Mostly in family home, but also in hospitals, in school, university, in plants, office, also in the metro, on the bus or planes, commutation network. Then there is the environment. So where the people are, there is a kind of density for people living in, for instance, in houses. So the density is lower, but you have, let's say, a set of 5, 6 people living together. But when they are working, for instance, they are in contact sometimes with 10 people, 15 people, not in close contact, except if it's in a plant. For instance, in plant, you can be much closer and have more contact with other peoples. In the train, in the commutation system, in the commutation network, you also have contact with people. If, for instance, this is winter, you have all the door closed and the window closed inside a metro car, then if somebody is sneezing, it can infect the people around him. So it's a kind of interaction with people. And then you have a set of variable rules, which is the last group. This one is designed by the government for instance, having some obligations, some rules. Social distanciation, for instance, mandatory mask is a rule. Opening only the restaurant at 30% of their capacity. Measuring the temperature before going into a mall. Obliging or forcing people to have the mask each time they are inside a building. All these are the variable rules that we can change. It depends on the rules of what the government decides to do. So this is a very, very important parameters. So the first 3 sets of parameters are fixed. These are corresponding to the society, to the country, let's say, to the social dynamics inside the country. And the last one is political. It depends on the decision that the government is taking. So it's not necessary to explain, sorry, to show, okay. It's not necessary to explicitly describe the reaction of people. You can just let these small agents, these small programs, interact with each other without programming anything. So in fact, we have a set of rules that we put on each agent. It could be millions of agents. Yes, in a country with 300 million people, we have 300 million agents. Each agent is a small program. This program is interacting with other agents. So it has the 4 sets of rules that I explained at the beginning. And let's say that, for instance, in a family, you have 2 persons, and the husband is going to work on his side, the wife is going to work on her side. And they have the husband, for instance, is working in a plant, and he has contact with several other people that have also families that are traveling by train or by car or by bicycle. Why not? Not in the winter. And then you have the wife is going on also her office, and she has contact with different kind of people. So sometimes in these interactions, there is somebody who is infected, let's say at the office, and the wife, because she spent, let's say, 1 hour working in the same office without ventilation, with one person who was infected, who bring home the virus. And in most cases, she will infect the husband. So the husband, in turn, will infect some people at work, may or may not, depending if he's symptomatic or not, what he has exactly, what is the situation with him. But all you can see that all these interaction between people are necessary to be able to make a pandemic, to make these people interacting with each other and getting the pandemic. So the agents, they are self-contained. So it means they are completely independent one from each other. They are autonomous. It means they can go wherever they want to go. It means, for instance, if you're between 20 and let's say 55 or 60, you're supposed to go to work. If you are under, let's say 20, you can go to university or to school, or maybe at home if you're too young. Or for elders, they are usually staying at home, or they are going to different places and meet other people. So we have these people who are self-contained, and they have their own reaction, their own actions for everyday life. They are autonomous. There is no program that tells them what they have to do. It depends on the category, social category, and the professional category, and also their age. They have a state that can vary. The state is usually infected or not infected. They have social, and they are heterogeneous. It means that we can have people with different categories, different age, different sex, different way of working and living. So all these small programs go into the world, interact with each other, and we can see, because their interaction are simulated, but simulated based on real interaction between people, we can see how these people risk to be infected, and how many will be infected if we inject, for instance, at the beginning of the simulation, 2, 3, 4, 5 people which already have the COVID-19. So these 4 or 5 people will start spreading the disease around them. And if there is no rules, no decision taken to block the pandemic, then it will go very, very quickly. I mean, in 1 month, you can have something like 10,000 people infected. And in 1 year, you can have several million people infected, or almost a large part of the population. So on these people, we are putting the rules that the government decide to put. So, for instance, mandatory masks, no more than one person in a car, closing the hairdresser, closing, having the restaurants at maximum 30% of their capacity. So all this makes that the pandemic will be disrupted. It will block sometimes the pandemic. It will not block. It will decrease the number of new cases, or it will sometimes does not block, and we will see more new cases than was expected. So it's extremely useful to have this system, not to be able to predict how many cases we will have in 1 month, for instance, or in 40 days. We have an idea, but we will not have a very precise number. But what we can see is that if the government is taking the right decisions, then we can see that there will be a decrease in the number of new cases. If you listen, for instance, from Boris Johnson in England, he was saying, okay, we will have a 30 days lockdown, but we don't know exactly what will be the situation after 30 days. So we will take new measures, or we will leave and release the lockdown. So it means that politicians and people, decision makers, they have no idea of what will happen if the decision they are taking are enough, or if they are enforce the rules and have the people use masks each time they are going inside a building, for instance. So it's extremely important to know what will happen. And with agent-based modeling, we can have these kind of informations. So as you can see, it's impossible for after you start the agent-based modeling, the simulation, it's impossible to know exactly what will happen. Some behaviors will emerge, some situations will emerge. They are not predicted from the beginning. We don't know exactly what will happen. And when we start 2 times the same simulation with the same parameters, we will get different results. Not very different results, but we can have sometimes some reaction, some strange results. For instance, in Qatar, they were deciding to close the airport at one moment and then to reopen the airport, and they didn't know exactly what would be the situation by reopening the airport. They were wondering if receiving 100 planes per day would increase the number of cases, or would it be under control? So they asked us to be able to do this kind of simulation. And we have been able to find that until, let's say, 20 passengers arriving every day at the airport with the disease, there would be no changes in the case because there is the quarantine, for instance, which is forced for people arriving. If there were not this quarantine, these 20 people would arrive in the society and will start spreading the disease all around. So they wanted to know, because the quarantine is 7 days, and sometimes people get infected after 10 days or 12 days. So they wanted to know what is the risk to have these people and to have a quarantine only for 7 days, and what would be the risk of having people getting the disease after, and what would happen. But luckily the percentage is low, and it doesn't change a lot the results for the number of cases in Qatar. So it's an extremely complex system because it works easily with 10,000 people, but when we have to modelize something like 10 millions or 20 millions, it means you have billions of operations that has to be executed every few seconds. So usually some countries, like for instance United States, are using HPC, which is high power computing system, so globally supercomputers. But we design in my company, we design a system that allow to do this very complex operation on regular computer. No need to use a very powerful computer. Because we redesign completely the algorithm from scratch, and they are much more efficient than what scientists usually use to modelize or to model a pandemic, for instance. So this is some kind of output that we can get. You see that we can have GIS. GIS is Geographic Information System. So the GIS shows what happens in different zones, in different areas of the country. How many cases do we have? How many recoveries do we have? And there is a heat map here that can show you with less details, but giving an idea where the localization of the most the highest density of cases in Qatar. But the good thing also is that by using agent-based modeling, you can, because you can model and specialize each group of people. I mean, elder than 70 years old, younger than 20 years old, the category between 20 and 30, 30 and 40, 40 and 50. We have a very precise way of checking how many cases we will find in each category of the population. How many cases we will not be able to detect? For instance, we detect only when we are doing the test. But when you have a number of cases and asymptomatic people, then you don't know, because they are not doing the test, but they are still spreading the disease. So without doing the test with the current methods, it's impossible. Using agent-based modeling, you know how many people are carrying the disease, and what is the number asymptomatic that we're calculating, and how they will infect and affect also the other group of the population. So we have this precision that no other system is able to produce, because what we get is something that is invisible, something that, because it's not measured, it doesn't exist, in fact, at this time. How many people are infected? We can say that there are, let's say, 4 million people infected. How many people are infected but do not show any symptoms? You don't know. There is an estimate, something like 8 million, for instance, or 12 millions. But we can calculate, and we can know exactly, not exactly, but approximately what is the number, the realistic number of asymptomatic, for instance. So we can also take the mortality by preconditions. So we can calculate if people have, let's say, tuberculosis or diabetes type 2, what will be the risk, how many people are affected, and what will be the situation for the people with preconditions. Also in Qatar, this is in Qatar, we have different nationality. The society is very stratified. You have the different strain. So you have Indian workers, Nepalese worker, Bangladeshi, but you have also Qataris. The Qataris are living more in houses. They have their life in large family usually, and it's very important for them to live with the whole family all together. Of course, which is extremely dangerous for the spreading of the disease, because at home nobody wears masks, for instance. It explains why in most countries, and particularly in this one, people are infected mostly in families, and more than at work or in the transportation system. So about the precision of the prediction that we can do, it's the more we learn about the pandemic, the more details we have about how spread the pandemic. For instance, we know that somebody with a mask, which is a surgical mask, if can get 3 times less possibility to get infected than without mask. And somebody with already infected with the mask can probably has 4 times less possibility to infect other peoples. It's not null, but we can do that. So in our simulation, if the government says, for instance, mask will be mandatory, we know that at home people will not use masks, but we know that at work and in the transportation system and in the supermarket or the malls, people will wear the masks. So we know how that the condition is the situation is less dangerous than it would be in other places. So this is something that we can do, and we can help the government or any government saying, okay, let's force people to get masks inside the buildings, because which show that it's very efficient. Because if we release this rule, for instance, the contagion, the pandemic will go, the number of cases will grow. But if we have these masks, then we will limit the number of infections. So it's very important. It's very useful for the government to have this kind of information, because they can take the right decision. So agent-based modeling is, I explained a little bit how it was working with pandemics, but you can use it in many different situations. For instance, for the stock market and supply chains. You can also simulate biowarfare. In case of for the military, you can simulate building evacuation. I will spend 2 minutes on this one. For instance, if you have a fire somewhere, so the civil defense can do a very precise simulation of what will happen if the building is empty, if there are, let's say, 10 people at the first floor, 15 people on the second floor, that these people are women, some are men, some are kids, for instance. All this can be perfectly simulated, and we can see, depending on where the fire starts, when the alarm is starting, how long people will take to evacuate the building, how many victims we should expect in this case. So this is extremely interesting for civil defense to know what would happen and to simulate different situations. We can also improve the security on autonomous vehicle because the autonomous vehicle usually are reactive to what happens outside around them. By using simulations, we can make the autonomous vehicle predictive and proactive about what would happen around him or it. We can also modeling the adaptive immune system, understanding consumer purchasing behavior, even that, understanding the fall of ancient civilization. You see there are a lot of different way of using agent-based modeling. Why people so far did not use it so much, except for weather, for instance, it's mostly because it needed before a lot of power computing. And we are really the first company in the world to have this kind of algorithm that can predict and that can work on million different cases, different situations with millions of agents, and be able to predict what would happen in few seconds without using supercomputers. So this is the end of my presentation.
Christophe, thank you very much. And what a very, very interesting topic, and what a disruptive technology and approach. The application of an age-based model, the ABM, to analyze and predict the evolution of pandemics. You spoke about how this tool retrieves preconditions and attributes, how it understands relationships and interactions, and then depending on how dense a people environment may be. And at the same time, defining variable rules, usually implemented by governments, such as social distancing or mandatory mask wearing. And of course, how people react to all of the above. And at the same time, how the technology uses the model to assess a situation, combining all sorts of different additional elements, right? It was also extremely interesting to hear about the various applications of the ABM and the technology in general. Going back to a pandemic situation, as the pandemic situation evolves, how close would you say the technology predictions, the model predictions, might be to what we feel is actually experienced, understanding that they are predictions based on certain circumstances and based on specific elements? How, as this evolves, how close would you say the actual to the prediction might be?
It would depend on a number of factors. First of all, it depends on the complexity of the society. It means if you have to modelize, let's say, a country like United States, you have a lot of parameters to take into account, different weather, because you have also to take into account the weather, the cities, how extended are the cities, what is the transportation system inside each city, where people are working, if there are plants, if there are offices, if they are working in the field. All these informations must be given to the system. The more information we give to the system, the more precise is the results. Qatar, for instance, is a small country. It's much more easier to modelize. And in Qatar, all the tests that we did, because we started the test in September 2020, we have been able to predict about 40 days with a 10% precision of what would happen. And then if meanwhile these 40 days were going, if the government changed the rules, let's say that they decide that, okay, we will release a little bit the limits and we will let people go to school, for instance, and have school by having only 50% of the children, what would be the results? So we can meanwhile the simulation is working, we can change something, a specific rule, and we can see how it will evolve, and we can see if it increase the risk, if it decrease the risk, or if it doesn't change anything. So I can say that for a small country, 90% precision. I mean, for if the country becomes very big, it will depend on the number of information that we could collect before being able to modelize a large country. But we did it for Argentina, for instance, and Argentina is 40 million people. And in Argentina, we're about 85% of precision on our system, a little bit less than Qatar, but it works. It works very well.
And of course, it may not be always easy, or actually in some cases impossible, to predict what may have triggered a pandemic. But do you feel what, let's say, how a pandemic may have emerged or created from and by and triggered by something? What kind of created a pandemic? But would you say that this agent-based model and technology would be able, based on certain components and elements, be able to foresee a pandemic emerging? So the model works with all sorts of different, as you said, the more we learn, the better the prediction. Yep. Now let's say something is not already triggered. Would this model be able to be used proactively to understand what the situation might be if a pandemic were to emerge?
I have a concrete example about that. For instance, in Qatar, we have a number of new cases. It was very, very stable during months. It was around 200 recoveries every day and 200 new cases every day. So it was horizontal. And then the cases started to increase recently. I mean, in end of December of January, something like that. And people were wondering, is it because there are some, let's say, less adherence to the rules, and people are removing the masks inside, etc. So we did try to explain using that, and we can play for the degree of adherence to let's say mask wearing. So we lowered this level of adherence, and we saw that it was not changing so much. So there were another factor, something different, that was increasing the cases, because the disease were more infectious and were spreading faster. So what would happen? And the only explanation we found is that probably the British variant or the South African variant, we have no way to be absolutely sure what is the variant that is here. But we can say that this is the problem. There is more infection here because there is a new variant that arrived in Qatar. So we are able to find these cases and to explain, but we are not absolutely sure. This is a job for epidemiologists, because what we're doing is mostly a tool for professionals. They can use it much better than we do. What we provide them is something that is extremely precise to handle a specific set of rules and behavior. And if there are some modification to bring, epidemiologists are probably much better, let's say, armed to do this kind of things.
Absolutely, and you are providing them with something extremely powerful and extremely useful. Christophe, thank you very much once again for your time and for your presentation and participation at the Leading Entrepreneurs of the World series. What you and your team are developing at ADGS is disruptive, groundbreaking, and extremely value-adding, to say the least. Thank you, and we look forward to speaking with you again soon.
Thank you very much, Stelios. Thank you.
Thank you very much.